Oh, hi, I'm Dr. Hoehn. I'm the lead acupuncturist and founder at Mighty River Wellness, and I have been collaborating for a couple of years now with HRC Encino and Dr. Peck. And we just decided to do this series together to just kind of inform, educate, and empower our shared patient base so that you guys, if you had any questions, we could have them address them and answer them here. All right, Dr. Peck, take it away.
Thank you, Dr. Hoehn. It's been such a pleasure to do this with you. It's been so much fun, and thank you for pushing me to get our voices out there and collaborate on, again, our shared patients, but also our shared professional journeys through spreading the word on fertility and acupuncture and how they mash up, but also to be open together and vulnerable and get our faces out there to help as many people as possible.
I love that. So one of the things that I feel like is when I think about my patients going through this journey, and it's a collaborative experience, but there's a lot of direction following, and the retrieval seems to be the hardest part of the process that you guys do. So we just kind of wanted to go over a couple of things about what the patient base can expect on the day of retrieval. So can you actually, for this first question, what actually happens during the retrieval day itself? We're going to jump right into the actual retrieval day for these questions.
Okay, wonderful. I mean, mind you, I'm talking from a voice from HRC and RSA at our surgical center, and this is going to be the flow. And I do like to rehearse this for my patients and I would encourage any patient wherever they're going to just sort of rehearse their day. So as they walk through it, they know what to expect. It really helps with easing anxiety. So this is usually what I would say to a patient. So, most of your appointments leading up until that point is only about 15, 20 minutes max in and out. But that day is like a 2.5 hour day. You do need somebody to take you home because you'll be under anesthesia and you don't want to be driving after. And we don't like patients getting into Ubers. We definitely want them to be with somebody that they know. So you start off, you come into the surgery center, you check in, you meet the staff, you lay on a stretcher and you undress and you get into your hospital-like gown, and one of the nurses will come in and they're going to put in your IV and they're going to have you go through some paperwork. And right now you're sort of in the waiting pre-op phase of the procedure. You meet with the anesthesia provider to go over your health history and to make sure you have any questions answered about the process. The anesthesia really just takes about 15 minutes. It's done through an IV. It's usually propofol. Sometimes they add some Versed or fentanyl, and this just depends on the patient or the cocktail that the anesthesia provider thinks is going to be the best match for the patient. And then after that, we go into the operating room, which is next door to our laboratory. The lab comes in. There's a lot of identifying steps. There's definitely a chain of custody with any type of human tissue. There's always a question of how do you know these are, my eggs, or if you have a partner that has sperm or my partner's sperm. So there's multiple checkpoints from even check-in when you're filling out your name to the lab coming in and re-identifying you. Once you're laying down on the table and your IV's in, and there's quite a few people in the room that day, there's me who's standing by you. I love holding my patients' hands. It's a really important part of my job that I really like to be present when my patient's actually falling asleep. That's a very vulnerable moment. It only lasts about 10 seconds once the propofol, which is this white milky-like substance, goes through the IV. If you count down for 10 seconds, you're going to be asleep and you're not going to remember any of the procedure. So that moment right before, it's really nice and calming to have some oxygen on your face, which you'll have, and the anesthesia provider right next to you. I'm standing right next to you, and there's about the lab that just ID'd you, and there's about 2 other people in the room that are going to help as runners and help with the different instruments while your eggs are being collected. So now, once you're laying down and you're on the table and the medication goes in, the next 15 minutes is very strategically focused work on everybody doing their part. The ultrasound that's been done every time vaginally is basically done again, but this time there is a little apparatus on top of the probe that is where our needle's going to go. And it's going to direct our needle right at the top of the probe to go straight into the ovarian follicles on ultrasound. It's very, very easy for us to see the trajectory of the needle straight into the follicles. So if you recall that the doctor's been measuring your follicles every one of your monitoring appointments, and they've been serially getting bigger and bigger, on retrieval day, this is our opportunity to puncture the follicle and suck out the liquid. So while you're asleep, first left or right, probe focuses on your ovary, needle goes in, ultrasound's watching, first follicles hit, suck out the liquid goes through a tube, the tube goes into a test tube, the test tube gets passed to the lab is given the tube, looks under the microscope, looks for the egg and shouts out, we got 1, we got 2, we got 3. So as you're going from follicle to follicle with the same needle entry, we usually just try and do 1 poke on each side. This poke is going through the vaginal wall only, straight to the ovary. Goes through each follicle, sucks out the liquid, and then when that side's done, we do the same thing on the other side. And then after that 15 minutes or so, you are then transferred to the pre-op room where you started to have your post-op recovery. And you're usually there for about 30 to 45 minutes. You're coming to, we have a conversation. I love making Post-its and coloring them and getting super excited about how many eggs have come out. And then once you start to become aware, which usually is about 15 minutes after you've been in there, then, and you'll remember maybe half of that period of time, then we have, our meaningful conversation about how many eggs came out and what to expect for the next couple days. You're given post-op instructions in like verbal and written form. And then you go home and it's best to rest that day. You find out the following day how many eggs either were frozen if you did egg freezing or how many eggs fertilized. And then I always see my patients about 1 week later to go over physically their recovery and symptoms, and as well as what happened in our laboratory for the week, whether you did eggs or embryo.